So if you come to see me and you've had an acute ankle sprain, it's important to know that almost all of those that I treat can be treated successfully without surgery. One condition that I see frequently and that really I enjoy treating is ankle instability. Now, ankle instability can occur after one single bad ankle sprain or perhaps repeated ankle sprains over the course of months or years, and typically involves damage to the ligaments around the outside of the ankle. Typically, this will show up in the patient as a feeling of the ankle giving way when they try to do activities on uneven ground or that involve side-to-side movement. And I think it's important for a patient to see me if they're having pain or swelling around the outside of the ankle, or these feelings of instability or giving way of the ankle. So if you come to see me with symptoms of an unstable ankle, we're going to get a history on that. I want to know, how many times have you sprained the ankle? What sort of treatments have you tried in the past, whether it's physical therapy or bracing? And what are the symptoms you're currently having? After that, I'm going to do a thorough physical exam. One of the major things that I look at is the alignment of the ankle, because oftentimes some changes in alignment can be a setup for these issues. We're going to evaluate for things like swelling, and the major evaluation that I perform is an exam called the anterior drawer exam. And that's a real sort of clever way to assess how much instability do you have in the ankle. After that, we're going to get some x-rays and see if we see any bony changes or we see any hints of this malalignment that I talked about. From there, perhaps we'll get an MRI, because the MRI is really the best way for us to look at those soft tissue structures that are often injured with ankle instability. And they may be beyond those ligament injuries that I talked about. They may involve tendons around the back of the ankle or cartilage inside the ankle joint. So getting a sense of what the whole picture looks like is very important before we define the treatment for you. So if you come to see me and you've had an acute ankle sprain, it's important to know that almost all of those that I treat can be treated successfully without surgery. Typically, I'll start you with immobilization in a boot or a brace, and after a few weeks of that, then we'll start some physical therapy. The physical therapy is real critical to get the motion back around your ankle, and also to redevelop that biofeedback between your brain and your ankle, so the next time that you go out, you can trust it. If patients fail that initial treatment, then oftentimes injections will be helpful. And ultimately down the road, some people will require surgery. And the surgery basically involves reconstructing, tightening, repairing your ankle ligaments so that you can trust it when you go out in the real world. For most patients after an acute ankle sprain, I'm going to give them about 4 months to declare themselves. That's going to give us an opportunity for all of the biological healing to happen in the body, for the swelling to go down, for them to work on range of motion and getting their strength back with physical therapy. And it's only at 4 months in that we really assess, are we winning the battle? If the patients are doing really well, then like about 95% of them, they're going to do excellent and go back to doing all of their activities without surgery. For the 5% or so, that's when we make the decision to think about a ligament reconstruction to help those patients get back to those activities.